Good afternoon or good evening, depending on where you are in the US right now. My name is Bonnie Harris, and I'd like to welcome you to Integrate Online, presented by the West Virginia University Reed College of Media. Our program offers renowned online master's degree programs in integrated and digital marketing communications. This session, we're proud to say, is brought to you by the award-winning Public Relations Student Society at WVU. So thanks so much to everybody for joining us. Today, we'll be discussing career chat, health communication with Maya Tretheway, Karlie Belle Price, Maddie Earnst, and Nikki Luna. Before we get started, I want to give you a few logistics. Remember that you can ask questions in the chat session, in the chat section of this session. And please, if your question is for a specific panelist, note that there. We'll try to catch them as we talk, but most likely we will be addressing those questions at the very end in our Q&A section. So I'm going to get started by asking each of our panelists to introduce themselves and provide just a quick snapshot of their career in health communications. Maya, would you like to get started?
Yeah, of course. Hi, everybody. My name's Maya. I graduated from West Virginia. I'll give you a little background on that too. In 2018 from the Reed College of Media. I was a strategic communications major with an emphasis in public relations, and now I work in pharmaceutical advertising. So I started my career as a project manager at Ogilvy Health back in 2018. And then last June, I came to FCB Health based out of Manhattan as a senior account executive. So I took that transition from the traffic world to the account management side, and I've been here ever since.
Fabulous. Thanks so much. I'm going to toss it over to Karlie.
Hi, everybody. My name's Karlie Belle Price, and I am from Madison, West Virginia, Boone County. And I graduated from the University of Charleston in Charleston, West Virginia, with a degree in mass communications. And I have worked in my current position for 16 years. I can't believe it's been that long, but yes, I have been here 16 years at Boone Memorial Hospital. We are a small 25-bed critical access hospital in Southern West Virginia. And I handle all of the public relations, the communications, the marketing piece. And then also I work in our new foundation that we just started at the hospital. It's called the Boone Memorial Healthy Living Foundation. So that's pretty much what I do.
Wow, you do it all. Nikki?
Hello, everybody. Nikki Luna. I'm with the WVU School of Public Health as its Director of Marketing and Communications. I joined the School of Public Health in fall 2019, so just a few months before the pandemic started. And prior to that, I was a strategic senior marketing strategist, there we go, for the Rockefeller Neuroscience Institute, which is on the WVU Health Sciences campus in Morgantown. And I joined their team in 2018. And so that really sort of marked the start of my health communications, and that part of my career. But prior to that, throughout my entire career, I've worked in higher education, going through pretty much the full life cycle of a student, starting out in recruitment and admissions, and then working my way over into institutional advancement and development, and doing relations. And I received my MS in Integrated Marketing Communications from the Reed College in 2012 is when I finished up my degree. And it was at that point when I realized I was working in development. I wanted to make a shift more fully in the marketing communications lane and sort of flex those skills, I should say, a little bit more after getting my degree. My undergraduate degree is in communications and applied music, and happy to be with you all this evening.
Thanks. And Maddie, I think.
Yeah. Hey, everyone. It's good to be with you tonight. So my name is Maddie, and I graduated from West Virginia University in 2019. And then after that, I moved back home to my hometown in Cincinnati, started off working at a smaller public relations agency, really focused on local clients, restaurants, event venue, and one was mental health services. So that was really my first kind of experience in the healthcare world, but that was definitely when I realized how rewarding it is. And that was like my most favorite client that I had. So then after that, I worked there for about 2 years. I shifted over to UC Health, which is where I am now, coming up on my 1-year anniversary. I'm a marketing consultant here, and UC Health is an academic hospital. So we're the only adult academic hospital in the Cincinnati, Ohio region. And I really support cancer and neuroscience marketing. So really just building awareness, increasing patient volume and things like that. So excited to be here. Thanks.
So much. Great intros, everybody. So we're going to start off with some specific questions for our panelists. And my first question is about working on the agency side. And we're going to go back to Maya. One of the things that I really like about this panel is we've got such a different group of the different kinds of healthcare communications that you can do. Maya, tell us about the agency work and what's that like as opposed to being on staff. How have you found the pros and cons, maybe the challenges of working on the agency side?
Yeah, I would say that the agency side is so much fun, although it's a lot of work for sure. It's just so much fun, and I get to work with so many different people, especially where I started in the project management side. I definitely got to work with all different departments, like our art directors, copywriters, our finance team, everything, all aspects of it. And then moving to account management, getting to maintain those relationships with my client, and then still getting that internal communication hub, everything like that. It's been super great. My favorite part of all of it is the different types of clients that I've gotten to work with. When I was at Ogilvy, I started off working in some consumer brands. So I worked for a lot of allergy brands with Johnson & Johnson. I worked for Zyrtec and Benadryl and children's Zyrtec as well. And then I did a lot of public service announcements for Genentech. So stroke awareness was one of them. We made a lot of commercials, patient brochures, posters, magnets. That was really fun. And now I'm in more of a HCP healthcare professional realm. That's my audience of choice. So the difference in advertisements, it's very cool to see that, I could be marketing to a patient like you or I, Bonnie, and then I can also market to my doctor who I go see, once a month and whatnot. So the different types of advertisements, I feel like I am very lucky to have gotten to experience that. And I'm still consider myself early on in my career. So that's been my favorite part.
I hear so much about the pressure of the agency side. Can you talk about that? Is that something that kind of accelerates you each day, or is it tough? I haven't worked for an agency. I've worked alongside them, but I see how much pressure sometimes you're under.
Oh, for sure. I am on a launch brand right now too. So my drug will be launching, fingers crossed, in May. So the pressure is real for sure. It's a lot of stuff going on, constant deadlines you have to meet. And then of course, just making sure your client's happy at all times while still maintaining that relationship with them. And then also keeping your team under wraps, making sure that everyone's happy. We can get things done in a timely and orderly fashion. I think that that's definitely the most pressure. Prioritizing is obviously hard everywhere, but when you have 4 projects all due at 5 o'clock on March 9th, how do you prioritize? So definitely building those relationships with your team and making sure that everybody feels grounded as well.
The measurement side of it too, aren't you really focused on making sure that you're getting those metrics back to your clients much more so sometimes than in-house? Can you say just a little bit about that?
Oh, for sure. Yeah, we definitely want to make sure that we're providing quality work. I would rather have something go out the door an hour later with a great final deliverable than have it be on time and then not be the best that our client wants, for sure. Along those lines too, we just want to make sure that we're staying in our financial aspect, and that being an account manager, you definitely don't want to go over budget, but then you don't want to be under budget because you want to make sure you're fully utilized, your whole team and everything.
Sounds like it's a balancing act that you're doing really well.
Oh yeah, it's definitely a circus for sure.
But a fun one. Circus is very fun, right?
Exactly. I love it.
Oh, good. Thank you. That was a great overview. We're going to turn to Karlie. And one of the things one of the notes that I got about students who were interested in health communications careers is that they saw the importance of getting timely health information, especially in light of the pandemic. And those of us who were working in communications at the beginning of the pandemic know that we were changing that information on a daily basis. It was high pressure. We also know that some of the hospitals, the regional hospitals in Appalachia in particular, are facing some real challenges. So in light of all that, Karlie, can you kind of explain what your life has been like the last couple of years and sort of the best parts of your job and challenges that you're facing?
Sure. Well, you used the word there, change. I mean, things changed so much with COVID. In our hospital, I mean, we had to stay aware and vigilant in communicating all the changes to our patients, to our staff, to our community. And so we had to change stuff constantly. We coordinated all the signage and the advertisements in relation to mask requirements, and then to all the screening steps when people entered our facilities, all the COVID safety tips and social distancing procedures. We were constantly changing visiting hours. So of course we had to put that out and make sure that we were advertising that to everybody, and making those changes as quickly as possible. You know, when you do things quickly, you worry about making mistakes. So we had to do it quickly, but also do it efficiently and accurately. And so we, you know, there were times we had to separate our sick patients from our well patients. We had to move patients around in the hospital. We had to move different services. We had to, I mean, we were constantly changing. We had to cancel procedures. So it was a huge challenge just to keep up with all that, on top of putting signs, I mean, all the way down to putting signs on our chairs for social distancing. You know, we were in charge, marketing was in charge of everything from big banners at the screening facilities to all the social media ads, to all the newspaper blasts, to all the videos, all the way down to putting the do not sit here signs on all the chairs. So we were constantly crazy and busy. And then another thing that really changed in our life was we used to have a ton of events. So in the PR side of my job, I plan a lot of the events, health fairs, blood drives, flu shot clinics, you know, COVID clinics, all kinds of different things. And we had to cancel those, which did really impact some of our patients, because we offered this kind of blood work at those events, and we offered this kind of flu shots or free flu shots. So we had to really change all that to do a lot of drive-through things, and really think outside the box with how we can still meet the needs of the community in this COVID world that's constantly changing. And we were able to do a lot of unique things. Instead of our Thanksgiving dinner, we help with this Thanksgiving dinner. We decided instead to do a drive-through Thanksgiving dinner, and we were able to feed 1,700 people in this small community during Thanksgiving. So we just had to really think outside the box, and we're still doing that to this day, how we can, you know, keep going and making sure that we're accurate with all of our news and media. So that was some of the big challenges, having to cancel events and completely changing things all the time. So I'd say that's the top two that were the hardest.
I'm curious too, because I don't think people understood that. I mean, we all knew, and we know that the doctors and nurses are still under a lot of pressure, but I don't think people understood sort of some of the ancillary roles like communications, the IT people and things like that. Like, I know I worked every day, I'm sure you did too, and at night. What did you do, and what is your advice for people around self-care? Because these are high pressure jobs. What were some of the things that worked for you?
I was going to say, well, I ate a lot of cheese fries.
I love that.
I gained 20 pounds. So I don't know if I did enough self-care, to be honest with you. So now that things are dying down a little bit, I really have noticed, like, oh my gosh, you were really, really stressed out this past year and a half. And so I really am focusing now a little bit more on myself with exercise and eating healthier. But our hospital has done a great job. Our administration has really done a great job in incorporating, like, we just opened a new gym. It's all free for employees. And they wanted that to be something, like you said, that self-care piece, to relax, rewind, And so they've been very, very supportive of our staff. And I can't imagine being a healthcare provider, because I know how stressed I was just as a marketing person, like you said, but our healthcare workers, it's just amazing how resilient they've been, and how, I mean, I have so much respect for all of our providers. But it was stressful for everybody in any healthcare industry, I think, on every level, really. So.
Well, my takeaway is going to be, number one is going to be, when next time I'm stressed out, cheese fries.
Cheese fries,
We don't
yeah.
really have a lot of those in Minnesota.
Someone's going to kill me like, Karlie, really, you threw out cheese fries at a health seminar?
Everything in moderation, right?
Right, moderation.
Absolutely. All right. Well, we're going to turn to Maddie, our social media expert. And I was looking at your bio, and it was interesting to me. My father was a pathologist and a cancer researcher. So, very intrigued by the work that you do around the topics of cancer and neuroscience, very serious topics, and you're in social media. So how do you feel, where does social media play in terms of communicating some of that complexity? I mean, how do you manage that? That must be kind of tough.
Yeah, it's such a good question, and it's a question that we think about every day, right? But so it's funny, I actually, when I applied for this job, it just said marketing consultant at UC Health, and I didn't know I was going to be placed on cancer and neuro. And, before this, I was in an agency, and I was kind of like, okay, I think I kind of want to switch over to corporate. I just want to be in a bigger team. I kind of want to get that bigger feel. And then I ended up being on the, given the cancer and neuro service lines, and I actually was a cancer survivor myself. So even just having that, this is like by far like the most meaningful thing that I've done. But to your point, cancer is the second leading cause of death in the US. Neuroscience, what does that even mean? Like, our research literally finds that it's not a consumer friendly word. So how do you communicate this to people, and how do you, make this resonate? So it's a question that we ask every day. But so my role really, we have a social media team, and my role really is to work closely with, the cancer team and the neuro team to see what they're doing every day, and taking it back to our social team to making sure that that's communicated on our social channels. So we don't have a specific channel for cancer and for neuro. It's really just UC Health social media channels. So, which that can be hard in itself, right? Because that's all kinds of different content. So just being able to fit that in there. But really what we're trying to do is just increase, we look at it, it's weird to think about it as a brand, but you look at the Cancer Center as a brand, and you look at the Neuroscience Institute as a brand too. So really that's what we're trying to do. We're trying to increase awareness of these centers, really educate, on who we are and what makes us different. And really what makes us different is that academic piece. So we partner, we're affiliated with the University of Cincinnati. And so that's what makes us different, is that academic piece. And then how do we portray that on social media when it can be really technical? So just a few examples of different content that we, is our go-to really is patient stories and testimonials. That's like one of the biggest ways to kind of just talk about what makes us different, and take like such technical research terms and technologies and have it spoken by the patient. So for an example, so we actually just launched this story literally today. It's a head and neck cancer patient, and he found out that he had neck cancer, he had throat cancer, because he couldn't do his Yoda. He's a Disney fan. He couldn't do his Yoda impression. Like, he just couldn't get the pitch. He's like, something is wrong. So we went to one of our local health systems, and they told him, hey, we're sorry. The only way that, we'll be able to take this cancer out is if we remove your voice box, and you'll never be able to speak again. So he got a second opinion, and knowing that, us being academic focused, we have this research and these specialized physicians to do the surgery. And so instead of taking out his voice box, they took cartilage from his ear, implanted it in his arm, and let blood vessels grow through it for 6 weeks, took that cartilage out, and then rebuilt his voice box. And he has his voice box, and he can talk, and he can do his Yoda impression. So I feel like in terms of like social media, it's letting people know and reaching people that there's other options, especially for these really rare types of cancers and types of neurological diseases. Other types of content that we really focus on, is health and wellness. Like, it's kind of our duty, right? Being a resource in our community. And one way we leverage that is through health observances. March is colorectal cancer awareness month. So instead of just like randomly posting about colon cancer, we're going to leverage this month, right? But for example, there's a new colonoscopy screening age recommendation. So we're really talking about that this month because of Colon Cancer Awareness Month. So stuff like that. And then we also leverage the channels just to talk about any like new physicians that join, and that really builds our awareness. Any system news. An example of that was we were one of 3 sites in Ohio that were chosen to get this new Alzheimer's drug. So, talking about that and getting that out. But even though we have all of these avenues, we still have to revisit them every day because it is challenging, and social media changes every day. I'm sure everyone knows that. So really just, using research to drive our messaging, and also just, being able to look at what people are talking about, what's trending, what are people searching on Google in terms of cancer, right? But like an overall answer is, I don't think there's ever going to be like the answer of like, how do you make this content like, totally accessible and relevant? It's just always changing. So.
Are you using any particular channels more than others which ones are you?
Yeah, that's a good question. And it totally depends. So, like when a physician gets an award or something like that, that really pertains to LinkedIn. But stuff like patient stories, like just totally shine on Facebook and on Instagram. But to your point, I mean, we have to be very strategic about what we're posting on each channel because it's really different. And we hear it every day, but physicians love Twitter. Like they just love it. So they're always like, post this on Twitter, post this. And then they're like, can we get our own Twitter? And so it's like all these things. It's funny, but yeah, you definitely have to have a strategic plan for each channel, 100%.
I work with a large practice of dermatologists here, and they want to put, especially the skin cancer surgeons, want to put certain things on Instagram that I always like, no one wants to see that.
Yeah, it's the best when they're like, hey, I think that the website should look like this, not this. Yeah. Like, okay, well, we studied marketing.
Yeah. I think working with physicians is a skill that we've all had to learn.
It takes time, and I've only been here for a year, and I think it feels intimidating, but you just got to say, hey, they put pants on too, and they're people too, And what's great about an academic, working at an academic hospital is they're teaching people every day. So they're not, it kind of feels less intimidating to be like, hey, we're doing this blood cancer content, but can you tell me a little bit about that? Because I have no idea. I'm in marketing, You're
still smart. You can figure that out. All right. Well, we're going to still talk about neuroscience and talk to Nikki, who I was reading this when I was reading the prep stuff, which is excellent. And I'm like, she works at the Rockefeller Neuroscience Institute and WVU School of Public Health. And so you must be superwoman in this. Can you tell us a bit about the difference between the two? Because I think people really don't understand the role of public health and how it's driven so much, particularly in COVID, but then also working with that institute. Just tell us a little bit about this.
Yeah, sure. And just to clarify on the superwoman part, that I'm not doing those roles simultaneously, thank goodness, because it would be a little overwhelming, but really great point on the public health issue, and just sort of, until the pandemic, and I think public health was one of those things that it was sort of fuzzy, like just like you said, sort of what is it? And in fact, a lot of our the national organizations that we partner with in the associations, they run campaigns year long, like what is public health campaign? And it's to reach prospective students and even the people who just are in the general public who don't know what it is. And so the pandemic really did bring a lot of that more to light. Although I will say there's good and bad to that. Well, obviously we know what the bad is, but when it comes to the actual understanding public health part, I think the pandemic in some ways has sort of narrowed our, the lens of what public health can be, because it's so expansive. I mean, it really touches on everything that we do, whether it work where we work, play, and live is sort of like the common line that you hear. But, but in terms of, public health versus, what I experienced at the Neuroscience Institute, you're really trying to convey complex topics to, your audiences are different. And Maddie touched on a lot of things that brought a lot of flashbacks back to me, in terms of working with physicians and trying to communicate to them and also that patient community, and really relay, these and sort of bring some understanding to these very complex topics, but they're life-changing. You're looking at, changing the course of Alzheimer's disease and affecting, changing the life course for someone who is suffering from substance use disorder by advanced technology and care that isn't done anywhere else in the world. And so in one respect, the Rockefeller Neuroscience Institute and School of Public Health are similar in that we're trying to convey sometimes complex concepts to people. And then the other similarity would be that it's really to improve public health and improve the health of all people.
How do you see, one of the things about the pandemic that was really glaring to all of us, and particularly in the times of the last couple of years, so many underserved populations that really aren't always, we can't reach them as readily as some others. Do you see that some of the things that we learned during COVID have really made our public health initiatives for those underserved populations a little bit stronger, or how do you see that's changed with some of that? Because it's brought a lot of things to light that people really weren't aware of before.
Absolutely. The pandemic certainly exacerbated a lot of the issues that, those marginalized communities face. And I think, it bringing a lot of that to surface is not only grown awareness, but it's also helped target resources to those areas too. So, in research that was happening, people are hearing about it more, and then some of that's being bolstered by additional support because of that awareness. So it's this nice, positive snowball effect in terms of getting funding and support and efforts to help alleviate some of those issues. Does that answer your question?
Yeah, I think so.
Take it a bit further.
Yeah, we could go a lot deeper in that topic, but I was just kind of curious on your perspective. I'm going to actually stay with you and give you the first question in our chat, if that's okay.
Sure.
I've got a couple others in here, but we have Pia's had this question sitting here for a while, and it kind of dovetails into the second half of our session, which is really going to be talking about. So I want the rest of the panelists to be thinking about the best skills that people will need for a future in healthcare. But before we go to that, Pia's wondering how the Great Resignation has impacted your team, and do you feel that it's hard to find staff?
Well, so in my current role, we have a very small team, a team of 2, and right now it's a team of 1 because in the School of Public Health we have the director.
I'm going back to the Superwoman comment then. I'm going to leave that with you.
So there's my business. Now I sometimes pretend that there's a team of 4, me, myself, and I, and then the communications specialist.
Okay.
But I will say, it is a timely question because actually right now that the communications specialist role in our school is vacant. And although we have made an offer and we have someone coming in the spring, thankfully, and I'm looking forward to that. But I will say to your question, I expected more applications, and this is the first time in several years that I've gone through the hiring process. So I was asking around colleagues, who have hired recently, what did your applicant pool look like? And it's recently, and their numbers were about the same as mine, but comparing it to previous, pre-pandemic, that it was much lower. Probably, I think I'm allowed to say this. I was less than 20. I received less than 20 applications for my position. And I think typically, you'd see at least double that, if not more. So in my little corner of the world, it definitely, the applicant pool was much shallower. And a lot of people was sort of the same, which you kind of expect, but it seemed to be one big clump of people with very similar skill sets, very strong, but they, it was rare to find candidates who could really, possess it all, have all the skills that you need.
Sure. Right.
And And unfortunately now, as all of you probably on the Zoom probably recognize, you really need to be able to wear a lot of different hats in our role. And so someone who can bring those types of skills to the table, they're going to be even more valuable. If you can do some multimedia production, if you're also a strong writer. Oh, and by the way, I'm a good relationship manager. That's sort of the cherry on top. So you really, have to be able to wear a lot of hats well. So that kind of compounds the issue of having a shallower applicant pool, but then also needing to be able, find someone who can do it all. It can be tough.
People who like to do it all.
Yeah.
Right.
And finding those people too. Yeah.
Dragged, creaking and screaming. Do any of the other panelists want to weigh in on that question about staffing and job up? I think it's probably based on, what are the job opportunities out there, and did anybody else have any Karlie?
Okay. I think too, the ability to not just with COVID, but just the ability to adapt to change, because like Nikki was saying, having to wear a lot of hats, and kind of that also the willingness to be able to learn new things, because I feel like in the PR, marketing, communications world, a lot of things do fall on your shoulders, whether it's social media management or the website, or whether it's writing articles and press releases or planning a ribbon cutting ceremony, and the list goes on. So yeah, that willingness to adapt to change and to learn and to be able to wear, like Nikki said, a lot of hats at one time. And it can be stressful, but it's really fun and really rewarding. I say that all the time. I feel like marketing, PR, communications, it's a super fun job. I love it.
And impactful in the healthcare. I mean, you're directly improving lives. I mean, Maya, you're, entered the workforce relatively last couple of years. Can you address the question of what you think for emerging professionals? A lot of our attendees are going to be starting their first jobs. What do you think are the most important skills? And is there an attitude that you think people need to have? I guess I always look at attitude as well as kind of those hard skills, but what's your take on this?
For sure. I think that personally, I mean, it's kind of any type of skill, like Nikki and Karlie were both saying, like wear any type of hat, especially in an agency. Like you could be working on one brand today and then another tomorrow and then a different one on Friday. So definitely just being able to flip flop and kind of multitask and understand different things at any point in time. I think that just when I came into the agency life, I didn't really have too much knowledge on it and the background and the process and kind of like how things get approved and then how they become, this manuscript to this banner ad on Facebook. And I think that was a real process in itself, learning. And I think that just being able to adapt quickly and learn things really fast will definitely help you in the long run, and just staying positive too, because in any type of day and in the agency, things change by minute. So like you think that you're going to have a project done at 4 o'clock today, and then you're up until 9 o'clock the next day trying to finish it. So being flexible, being positive, and Bonnie, like you said, the attitude is everything, but just having a good attitude and going into it with an open mind is always a plus.
Maddie was talking about just how fun it is to learn something new, and you're working with material that you've never seen before, and particularly in neuroscience. Maddie, you probably have a lot of that. What do you think, Maddie?
Yeah, well, one thing I wanted to point out that might ease students' minds, and it might not be like this everywhere, but I coming into this role, I really didn't have a ton of healthcare experience and background, and I actually looked around and most of my coworkers didn't, and they're like, it's okay, you can learn, so I feel like there's a lot of pressure. You're like, okay, well, I've never worked in healthcare, I've never done this, am I really going to fit this role? I think as long as you are ready to learn, eager to learn, that helps so much. And really just in healthcare, caring about helping other people, because at the end of the day, that's what it's about, and being passionate about reaching the people who need to be reached so you can help them. But yeah, I would just say don't ever get discouraged if you don't have a tremendous healthcare background, because it's not about that, at least not where I'm at.
Yeah, Maddie, that is so true. Like coming into the healthcare field, I remember thinking like, I didn't take any classes in college on healthcare. I don't know anything
Right.
about this, but it seriously is like not scary. It's so easy to adapt to if you're willing to learn and you're open to it. And a lot of terminology, but if you find the good people around you, then they'll definitely help you along the way.
I
Yeah,
agree with you,
so
girls.
true.
I didn't have any experience in healthcare either. Yeah, I totally agree with that. And I Google a lot.
Yes, Google is your friend.
Yeah.
And not to be a joiner here, but I'll jump on that train too, and say, yeah, no healthcare experience prior to this. And the other thing I'd like to add to it's sort of what, one thing Maya touched on is just, and Maddie too, is, attitude really is a huge component in this. And I think, even as I conducted this recent search, now I was fortunate that I did get an applicant who had all the skills I was looking for, and she had a fantastic attitude too. And I felt like, fit is such a big part of that, and having that positive attitude, bringing that to the table, you're more than likely going to be a good. And the team, even though we're a team of two within just the School of Public Health, I am part of a larger team of, university relations, health sciences, first of all, that then channels up, goes up through our university relations, our main team. And so we all work together. Now, when we're just doing School of Public Health stuff, it's a lot of times it's just the two of us, but without that team, there's no way we would be able to do the things we do. So overall fit and being able to work well with other people and be collaborative is definitely key.
And I also tell people you're working with doctors who are explaining things to patients every single day. I used to work in the tech industry, and believe me, those people can't explain much to the consumer, but doctors are very good at explaining in simple terms or in layman's terms what these things are too. Nikki, we have a question for you. It's a big one that I think other people might really want to weigh in on, but I'll start with you because it was directed at you. How, if at all, and I know that you do you tackle misinformation and disinformation and its impact on public health literacy?
I actually, we haven't had to deal with that much, within our team. And I'm fortunate, let me start over, because, a lot of the information that we're putting out on the School of Public Health on our channels, it's really taking information from experts who are sharing it with us, and then sharing it, with our top level university relations leaders, and then that sort of disseminates down, and we're sort of amplifiers of that. So I'm fortunate in that, I know what I'm getting is solid information, where we also look a lot at the CDC guidelines, things like that. And so we're not, and maybe this is surprising, whenever we share things, I'll use social media, for example, we don't get a lot of there's not a lot of controversy that comes up on our channels, and so we haven't had to deal with that head on. We're probably pretty fortunate in that sense. We are the youngest of the 5 academic units in the health sciences. And so part of the territory, means that we have a smaller following on some of our social channels, and probably if it were a little larger, we might run into some of that. But for the most part, we haven't had to deal with much of that. But I would say if we did, we would certainly look to our experts to help, and then sort of translate that, as we've talked about how important it is to whittle that down to a message that's consumable by everybody. But, we were lucky because we have experts, doctors and public health experts to help us craft the right message and counter that misinformation.
Right. And I think the right message, well crafted, is often the response itself, right? So you may not get as much of that if it is well crafted. Did anybody else want to take on that question? Maddie, have you run into that working in social media much, or?
No, not much. I think Nikki, honestly, I think you said it perfectly. It's one of those things where if it does come up, we have the resources that we need and the experts around us to help. So I haven't personally run into it though yet, since being here.
Well, that's good news.
It's a good thing. Yeah.
Did anybody else have any comments on that question? Didn't think so. So I want to encourage everyone who's attending to put questions in the chat. I've got another one here that was from our excellent prep team for this panel. And this is, we want to hear from each of you 1 or 2 pandemic-driven changes that are continuing to impact the space you work in. So I don't know who wants to start with that.
I can start.
All right, thanks, Maya.
I would say that my biggest pandemic-driven change was I was working at Ogilvy on the medical education team, and my main focus was basically doing congresses, conferences, and ad boards, prepping all the materials, shipping, working with everybody on our team to make sure they're at the location in time, making sure all the meeting logistics are in details. And then in March of 2020, that kind of just all stopped and there were no more live meetings. And I found myself almost like twiddling my thumbs, like, what am I going to do now? But within 2 weeks, all of that turned virtual. So, QR codes on everything, being able to organize meetings like this in Zoom, especially for conferences. I mean, creating breakout rooms just to make sure people can have conversations and stuff. I feel like that was just a turn around and get ready. Like, we still got to have these conferences. We still got to have these ad boards for doctors. And it was a really probably my biggest shock in my career so far, because I was like, oh my gosh, I didn't realize that things like this could go virtual in 2 seconds. And now here we are.
I don't think any of us realized that. And I always wonder if it made our jobs harder because we weren't in person, or if it made it easier because our bandwidth was so much better. I don't know who wants to take that question about the pandemic changes next. Karlie, you want to give it Maddie, go ahead.
What you said, Maya, is so true. Especially with working as, with physicians as your clients, with them being so busy, I think a positive, and you can kind of look at it as, I guess, a negative. A positive, they're more accessible. You can meet with them, more easier. But then again, having that interaction in person is important too. And then I think one thing that we're still trying to work through on a daily basis is really capturing that, patient-physician interaction in terms of video and photo. And we don't want to go into these spaces and make people feel unsafe. So now that things are, feels like they're letting up a little bit more, we're starting to get back into it, capture, some of our treatments and collaboration of the team. But that is something that's been really hard because it's obvious, patients are first and we don't want to, make them feel uncomfortable. So that's kind of one thing that's definitely changed.
One of you want to go next?
I guess I'll go. So what Maddie just said, what both of them just said, we, from a hospital standpoint, we are still having to, well, let me back up. So one of our departments, they're not seeing quite as many patients as they had seen prior to pandemic. And so some people are still scared to come to our hospital. They're which rightfully so, I understand. And so we are working to try to make people feel safe. So a lot of our marketing efforts right now are going to remind people that, we clean daily, we disinfect daily, you don't have to go in the hospital in a lot of these, specific departments, and we can screen you at the door, and just all kinds of different things just to remind people that it is safe and it is clean and you have to wear a mask. And a second piece of that is we met with a marketing firm, and we're going to do some commercials, and we're going to do them at the end of April. And I was like, well, do people have to wear masks or do they not? Or, because this is going to be a commercial on television. And so what we decided was we would do some video with masks, some without masks, and then depending on where we're going to roll that out. So, we have to figure all that out with the videos and all that stuff. And then we're also doing telemedicine, where a lot of patients are, obviously, seeing their physicians for psychiatry and different things using telemedicine. So that's been pretty neat to try to, learn a little bit more about telemedicine and how that works with patients and how it works with patients who don't have internet access and on and on. So those three things have been pretty big changes that we're still dealing with right now. So.
Were you dealing quite a bit with external media and earned media and PR? Did you have a lot of inbound reporter requests during the pandemic that you?
Oh yeah, we got phone calls all the time about can we come and do a story on your, we see that you've changed your patient visitation to only one patient per so many hours per day. I mean, we've had so many changes. I can't even remember what it is right now. I think it's 2 visitors on the same day. I don't even remember what it is. but so yes, our different stations called us all the time wanting to come in and do stories on a number of different things, but they don't as much now, but at the beginning it was constant. It was constant.
It's crisis communications basically for
Right.
hospitals. So
Right.
I'm sure that was another, I mean, that probably added a whole nother full-time job on top of your full-time job.
It did. It was very, very busy all the time. But we were glad that they came to get the word out and to remind people, the things that we were doing to try to keep our facility safe and to ease people's concerns a little bit. So we appreciated the media coming out and taking the time to meet with our patients and to meet with our staff. And so it was actually fairly helpful when they would come out. So
Nikki, do you want to talk about how some of the pandemic driven changes that you may have had in your role there?
Yeah, the first thing I'll say came to mind was that I cannot imagine. I was thinking about my time at the Rockefeller Neuroscience Institute, the RNI, and I don't think I would have been able to survive if there would have been a silver lining in some ways, but to work remotely and also try to understand, everything that was happening there, because it was so much. I mean, it was just, the research, the clinical, and then the education part of all of that, so robust. And I mean, I had the privilege of actually being in, some of these procedural rooms and observing, and just to help onboard and understand. Maddie, I mean, you're nodding your head and you probably can relate to some of that. So trying to, really immerse yourself would have been really tough. Now, so having been at the School of Public Health throughout the pandemic, there were things that, for us, our students, we take a student-centric approach in everything. And I think this was sort of across the board for the university. Being a health major didn't really matter, but we waived things like the GRE, and we were more, we relaxed with like our application deadlines and things like that, trying to be understanding with students. And then when it came to actually doing some of the work of our office, some of the things that we would normally do day to day, a lot of that did have to come to a stop, because a lot of our students, for their experiential part of their curriculum, they go out into the community. They're working with local and state agencies. They're working with, nonprofits and all of those in the health realm. And similar to what others have said, there were a lot of restrictions in place. We didn't want to make patients feel uncomfortable. We wanted to make, so we had to pull back on just about all of that. And a lot of that, I mean, I'd only been there for about 5 months, and we hadn't really dug in much because I was still, getting sort of acclimated. So we have a lot of catching up to do, I think, getting back into normal mode, or however we want to put that. But but in terms of the experience for our students, some of them, even those who are working with nonprofits that are in the healthcare realm, I think having this virtual, they're still able to find placements, field placements, and experience opportunity that give, and they can do it remotely, which has been fortunate for them. And I think public health is sort of an outlier in a way in health sciences, in that a lot of our students aren't necessarily involved with direct patient care, even though we're still part of the healthcare field, and so that opens up some more opportunities for them, fortunately.
Great. We've got probably 9 minutes left, and I don't have another question there. So I'm going to ask my question from each of the panelists. And that is, now all of you have said that I think most of you said you weren't in healthcare before you started your career. You didn't come out of biology degrees and things like that. And we know that people who go towards healthcare communications typically are people who want to contribute to the greater good and want to be helpful and that. But what is the thing about your work or the work that you're doing that you really like, that was either a surprise to you or might be a surprise to some of these students who are looking at this career, like an aspect of it that you think about when you go to work and you're like, boy, I'm really looking forward to doing this. I know for me, it turned into writing. some of the thought pieces for some of the positions that I do, which believe me, I never thought that would be my favorite part. But I don't know if any of you have kind of something that comes to mind that would, be of interest to these students to really look forward to, or things that you like to do.
Yeah, I would say just working on pieces and brands that resonate with me. Like I currently at FCB work on Eli Lilly is my client, and I work on diabetes. And my grandmother has diabetes, so it really resonates with me that I'm able to contribute in some way to these pieces that are going to go to healthcare professionals that will be helping their patients with this new drug or anything else. So I think that just being able to say like, hey, I played a part in that, and that makes me feel really good that it's now out in the market and helping people, I think is my favorite part.
And that personal connection, that makes a lot
Exactly.
of sense. Yeah, that's cool. Anybody else want to chime in?
When I was introduced to public health, I knew very little about it too. And once I understood that really at the heart of it, at the foundation of public health is the idea that health, good health it isn't a privilege, it's a right, for everybody. There shouldn't be barriers to accessing good health care, maintaining good health. And so that's sort of the North Star that I like being a part of, even if it's a small way. The contributions that our office and our larger team makes, I think it's really important and compelling. And then at the tactical level, I really just like the creative process. I love, brainstorming with people, being creative, like, picking apart videos and, creative pieces that we're doing. I like that process too. So I think it's a good pairing for me at public health, having something that feels bigger than yourself and you're contributing in some way, but then also enjoying the type of work that make it, come to fruition.
Sure. Karlie or Maddie, do you have?
Yeah, I can.
Go
Oh,
ahead, Maddie.
okay.
go.
Maddie, I asked you both at the same time, so it's totally unfair.
I was like looking at Karlie, like, should I
We'll
talk?
see how your collaborative skills are here, but let's go with Maddie.
I would say my favorite part is just the storytelling part with the patients.
Mhm.
I'm especially recently I've been given more opportunities to talk to patients like one-on-one, really hearing their stories. Like for example, March is Brain Injury Awareness Month, and we did a story on someone in 2018, and we wanted to repurpose her story. So I called her yesterday and was like, just asked her like how she's doing, and she's like, I had a baby, like she was in a car accident and had to remember how to walk again and how to talk again and all those things. And she's like, I've had a baby, I graduated from nursing school, and now we're taking that and talking about where she is today and like blowing it up on social and our websites. And it's like obviously a feel good thing, but it just gives me chills every time. Every time. It's definitely just an emotional part because it's incredible. And then just being able to see like what research and our physicians are capable of. I mean, it's insane. Who would have thought to take cartilage out of the ear, to put it in an arm and rebuild a voice box? Like what? Like just stuff like that. It just amazes me.
Great answer, all of you. Well, Karlie?
Oh my gosh, you all did so well. I should just say what they said. So I'm a little bit different in that I'm in my hometown. And so I got to come back and work where I was basically born and raised. And the hospital where I work, we opened, it started, 1964 was when the hospital opened. So over 55 years or so. And what's really neat is we just opened a new hospital, same name and everything, same location, opened a brand new hospital in 2006. So it's just crazy how much we have grown and how many new services we're able to provide to the community where I was raised. So the fact that we can help so many people and we have so many services now that are close to home, so people don't have to travel as far, and just watching the hospital grow and grow. When even just 5 or 6 years ago, we had 200 employees and now we have 450 employees. So that I can see people in the community who I grew up with and things like that get new jobs and get more jobs because we keep growing and are able to provide that in such a small town is amazing. And then all the community projects, like I love working on all of the blood drives, like I said earlier, and the health fairs and the 5Ks that we go out and do in the community, and giving donations to all the different schools. We sponsor a lot of ball teams and a lot of nonprofit groups and are involved with the schools. So that community connection for me too is just, it's awesome. And like you talked about the hats, we wear so many different hats in these roles that it's like something new every day, something new and exciting and different. And that makes your job fun. So it's very creative every day, I feel like, which is, I just think we have a fun job. I think our job's fun. So
I don't think it's ever boring.
no, it's never boring.
All right, well, I think we're at our end time. I wanted to just say to the panelists, you did an amazing job. Thank you so much for your perspective and just for your thoughtful responses. I learned a lot. So special thanks to all of you. To all our attendees, be sure to visit integrate.wvu.edu for upcoming sessions, recordings of previous episodes, including this one, and to subscribe to receive updates. Also, be sure to check out the rest of the Comms Fest schedule at communicationsboard.org. So with that, I'll say good night to all of you and thanks again, and have a great evening, everybody.
Thanks for inviting us.
So much. Thanks, Bonnie. Thanks, everyone.
It's
Bye.
fun, guys. Bye.